بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. هنتكلم عن اللارج فوليوم بارنترول. اللارج فوليوم بارنترول defined as sterile isotonic version free aqueous pharmaceutical preparation intended for intravenous administration. According to UCB, they apply to an injection that is intended for intravenous use and is packaged in container holding 100 ml or more. كلنا نعرف انه الاي في route of administration is used to reach maximum drug serum level for drugs which decompose by gastrointestinal secretion, for drugs which affect the gastrointestinal tissues, for the patient who can have nothing by mouth, for the patient who is unconscious or uncooperative, for rapid correction of fluid or electrolytes as in case of burn or dehydration, for cancer patient as TPN in intensive care unit. Common uses for large volume parenteral solution without additives include correction of electrolyte and fluid balance disturbance, as nutrition, as vehicle for administering other drugs. Large volume parenteral products include infusion fluid, TPN or total parenteral nutrition solution, intravenous antibiotic, patient controlled analgesia, dialysis fluid, irrigation solution, blood collecting unit with anticoagulant. ده الشكل بوضع shapes of large volume parenteral container, bottles, glass bottle and some bags. General characteristics of large volume parenteral preparation. As they administer intravenously, they must be sterile, free from microorganisms and pass sterility test. They must be isotonic. The osmotic pressure of the preparation is similar to osmotic pressure of the blood. They must be version free. They must be free of air bubbles or particulate matter. They must be clear. They have pH similar to physiological pH. They may be contain antioxidant. The use of preservative is prohibited. In general chapter, pharmaceutical compounding sterile preparation in UCB, pharmaceutical compounding sterile preparation established requirement for aseptic preparation of sterile dose form under aseptic condition, of course. That it provides guidelines for development of policies and procedures for the safe preparation of sterile preparation. UCB General Charter 797 describe a number of requirements including responsibility of compounding personnel, training, facilities, environmental monitoring, and the storage and testing of finished sterile preparation. Common large volume parenteral solution. Four common solutions used either as large volume parenteral solution or as a primary part of an admixture solution. They are sodium chloride solution 0.9% weight per volume, dextrose solution 5% weight per volume, Ranger solution, lactated Ranger solution, and also various combination of different strengths of sodium chloride and dextrose solution are available. Saline solution. It is a solution of sodium chloride in sterile water for injection. Its strength 0.9% weight per volume. It is called normal saline or saline solution or physiological solution. It contains 9 grams per liter sodium chloride, has osmolarity of 308 milliosmol per liter. It contains 154 milliequivalent per liter sodium and 154 milliequivalent per liter chloride. It is used for medical purposes such as intravenous therapy for severe dehydration. It is also used as a rinse for contact lenses and is used in wound care for irrigation, cleansing and hydrating wounds. Dextrose solution, 5% dextrose solution. It is a parenteral fluid and neutron. Each 100 ml of 5% dextrose solution injection contain dextrose hydrous 5 gram in water for injection. The caloric value is 170 kilocalorie per liter. The osmolarity is 252 milliosmol per liter, which is slightly hypotonic. 5% dextrose and 0.9% saline. It is a sterile non-pyrogenic solution for fluid and electrolyte replenishment and caloric supply in single dose container for intravenous administration. Treatment of sodium depletion, extracellular dehydration, or hypovolemia in case where supply of water and carbohydrate is required due to restriction of intake fluid and electrolyte by normal routes. Ranger solution. It is a solution of several salts dissolved in water for purpose of creating an isotonic solution relative to the body fluid. Typically contains sodium chloride, potassium chloride, calcium chloride, and sodium bicarbonate, with the last used to balance the pH. Lactated Ranger solution. It is also known as sodium lactate solution and Hartmann's solution. It is a mixture of sodium chloride, potassium chloride, calcium chloride, and sodium lactate in water. It is used for replacing fluid and electrolyte in those who have low blood volume or low blood pressure. It may be used to treat metabolic acidosis in cases other than those caused by lactic acidosis and to wash the eye following a chemical bill. Lactated Rangers has an osmolarity of 273 milliosmol per liter, pH of 6.5, and caloric content of 9 kilocalories per liter. Total parenteral nutrition, or TPN. It provides nutritional support to patients who are enabled to take sufficient nutrients through their digestive tract. It contains macro and macronutrients. Macronutrients, dextrose, fat, and protein. Micronutrients, electrolyte, vitamins, and trace elements, in addition to lipid in the form of an emulsion. Dialysis solution. Dialysis is the passage of small particles through membrane. Renal dialysis as artificial kidney. Peritoneal dialysis, where a solution placed in and emitted from the peritoneal cavity to remove toxic substance from the body. Irrigation solution. They are not administered directly into the venous system, but are subject to the same stringent control as intravenous fluid. Surgical irrigation. Solution used to pass and moisten body tissue, dressing or wash instrument, as sodium chloride for irrigation or sterile water for irrigation. Urological irrigation solution used to maintain tissue integrity or remove blood to maintain a clear file of vision, as glycine 1.5%, sorbitol 3% are commonly used because they are non-hemolytic. Production of large volume parenteral products. The fluids are produced and filled into container under aseptic condition. After filling the container, the glass container sterilized by most heat sterilization method or steam sterilization. The other container sterilized by either ethylene oxide or radiation removal. Container and closure. Large volume parenteral fluids are packaged into glass bottle, polyvinyl chloride or PVC collapsible bags, semi-rigid polyethylene container. Character of the container and closure used for packaging of parenteral product. They must maintain the sterility of the packed fluids. They must be withstand sterilization of the product. They must be compatible with the packed fluids, allow withdrawal of the content. Advantages of a glass container: they are transparent, chemical inert, used for products that are incompatible with a plastic container. Disadvantage of a glass container: they are much heavier than plastic. They are brittle and subject to damage during transport and storage. During use, they require the use of an air inlet filter device for pressure equilibration within the container. Particles of glass can be released into the injection fluid. Damage to the neck of the bottle may result in contamination of the container content from the external environment. Polyvinyl chloride collapsible bag are used to package most infusion fluid. They are designed with a port for the attachment of the administration set and an additive port for the addition of small volume parenteral fluids. Characters of PVC collapsible bags: they are resistant to impact, flexible and collapse during fluid administration, don't require an air inlet system. Disadvantages of plastic bags: they permit a high moisture penetration. They absorb some drugs. They require an extended sterilization time due to the heat resistance of the PVC. Semi-rigid containers have the following characteristics: they are more drug compatible than PVC containers. They are difficult to break down, don't fully collapse. Semi-rigid container or bags have the following disadvantages: they need extended heat sterilization time, need air equilibration. Semi-rigid bags are designed with two ports. One port allows attachment of the administration set. The other ports for the addition of a small volume parenteral product or a small volume infusion fluid. They have a graduated scale that can be read either in an inverted or upright position. The slide displays semi-rigid infusion bag. This slide shows polyvinyl chloride infusion bags or collapsible bags. Administration of large volume parenterals. All large volume parenterals are administered to the patient by a parenteral route using a wide variety of administration sets. These sets are packaged as sterile units intended for single use. Fluids move through them by gravity at a rate that is affected by the physical characteristics of the fluid and the fluid pressure determined by the height of the infusion above the patient. The administration set is made up of a rigid plastic spike that is inserted into the rubber septum of an infusion container. IV sets. An IV administration set is a sterile, pathogen-free, disposable device used to deliver intravenous fluid to patient. Contents of IV set: a spike to enter the rubber stopper or port on the IV container, a drip chamber for trapping air and adjusting flow rate, a control clamp for adjusting flow rate or shutting down the fluid, flexible tubing to transport the fluid, a needle adapter for attaching a needle or a custom. This slide shows the description of infusion sets. IV sets have the following characteristics. IV sets are sterile and non-pyrogenic. Each unit is supplied in packaging that ensures the maintenance of sterility. Rigid parts of an IV set are molded from hard plastic. Most of the length of the tubing is molded from the elastic PVC, but PVC set should not be used for nitroglycerin, which is absorbed by the tubing. Despite nurses generally have the responsibility for attaching IV tubing to the fluid container, establishing and maintaining flow rate, overall regulation of the system, a complete understanding of IV sets and their operation is important to pharmacists. Piggy bag, intravenous administration. An intravenous piggy bag or secondary infusion is the administration of medication that is diluted in a small volume of IV solution through an established primary infusion line. The piggy bag can be administered by gravity or by IV infusion pump. The secondary bottle contains the medication. This may be single dose or multiple dose. A piggy bag permits serial administration of IV medication without requiring that the tubing be repeatedly disconnected from the patient and replaced, which can increase the risk of infection. In this configuration, the secondary infusion will flow preferentially into the tubing while the primary infusion will pause. When the secondary infusion is complete, the primary infusion will resume. Filters. They are used to remove contaminants such as glass, debris, filter and rubber cores. They will not remove virus particle or toxin. Filter size include 5 micron or random pass membrane filter, remove large particulate matter, 0.45 microns inline filter for IV suspension, 0.22 micron remove bacteria and maintain a sterile solution. Catheter. They are devices inserted into veins for direct access to the blood vascular system and are used in two primary ways. Peripheral venous catheter, which are inserted into a vein close to the surface of the skin. Center venous catheters, which are inserted deeper in the body. Intravenous admixture. The combination of parenteral dose form for administration as a single entity is called an admixture. Because of convenience, IV fluids are frequently used as vehicle or carrier for other parenteral drugs, which called additives. These are prepared by adding at least one sterile injection to an intravenous infusion fluid for administration. The injection to be added are either an ampoule or vial, or may be reconstituted from a solid. This addition should be carried out using a aseptic procedure in a grade A environment within an isolator cabin or clean room facility, air laminar flow. This environment is required to maintain the sterility of the product and avoid contamination of the product with particulate matter, microorganisms, and pathogens. Clean room. A room in which the concentration of airborne particles is controlled and which is constructed and used in a manner to minimize the introduction, generation, and retention of particles inside the room, and in which other relevant parameters as temperature, humidity, pressure are controlled as necessary. The basic function of a clean room is to protect the manufactured product from contamination. The contaminants are generated by people, processes, facilities, and equipment. The level of air cleanliness in the room must be regulated by standards. Laminar flow hood. Carefully enclosed work area designed to prevent contamination. Air is drawn through a high efficiency particulate air filter or HEPA filter that removes particles larger than 0.5 micron. The purified air then flow over the work surface at a uniform velocity. Laminar flow. The cabinet is usually made of stainless steel with no gaps or joints where spores might collect. Horizontal flow hood. Laminar flow hood where the air crosses the work area horizontally. Vertical flow hood. Laminar flow hood where the air crosses the work area vertically. Continuous drip versus intermittent therapy. Basically, drug additives are administered via continuous slow intravenous drip over several hours period or an intermittent intravenous administration over a period of minutes rather than hours. In continuous slow intravenous drip, the drug product is added to a large volume and is administered over a 4 to 24-hour period. This method is suitable for drug products that are compatible together or stable at the pH of the preparation and are not especially irritating at the site of injection. In contrast, in intermittent intravenous administration, the drug product is administered in a small volume of solution over a period of several minutes rather than hours. Advantages of intermittent intravenous therapy. Avoid instability problem. Avoid incompatibility problem. Avoid irritation of some drug product by minimizing the length of time the solution is in contact within the vein. To promote better diffusion of antibiotic into tissue because the greater concentration. The way for sending intermittent intravenous therapy. The pharmacist sends many bottles, usually 50 ml, containing the drug product to the patient care area. The pharmacist sends the drug product either reconstituted or not reconstituted, and the nurse injected into a special volume of large volume parenteral. The pharmacist sends the drug product either reconstituted or not reconstituted, and the nurse injected directly via an injection site on the IV administration set tube. Labels for IV admixture should bear the following information: patient's name and identification number, room number, fluid and amount, drug name and strength, infusion period, flow rate, expiration date, additional information as required by the institution or by state or federal guidelines. The slide display examples of pharmacy prepared labels for a mini bag and for a large volume parenteral. Intravenous admixture are the preparation consists of one or more sterile drug product added to an IV fluid, generally normal saline solution or dextrose alone or in combination. These parenteral drug solutions are commonly mixed in the same infusion bag at the Y site junction where two or more IV lines meet and in the same syringe. IV incompatibility occurs when two or more drugs are administered through a single IV line or given in a single solution, resulting in an undesirable reaction. A patient who receives a preparation in which an incompatibility has occurred could experience toxicity or an inconvenience therapeutic effect. Incompatibilities. An IV admixture is said to be incompatible when the prescribed drug cannot be combined safely and satisfactorily. The incompatibility may be between two drugs or between a drug and the IV solution. Characteristics of incompatibility. Some incompatibility result in a physical change that is easily recognizable. This change may be change in color, evolution of a gas, development of a haze, or formation of solid particles that settle out of solution. These are the most obvious incompatibility to detect because they can be seen. Other incompatibilities can not be visually recognized. Two drugs can react to cause the degradation of one or both. These incompatibilities are not detected visually, but they can be confirmed by analytical method. The physical exchange sometimes are expected and are not a problem. For example, variation in color of imipenem, cilastatin, or dopamine don't affect potency. When ceftazidime is reconstituted, carbon dioxide gas is released and positive pressure develops. Accumulated gas should be expressed from the syringe or benched from the vial before administration. The precipitate that forms when pyrrolitic cell is refrigerated dissolves at room temperature. Contribution factor in incompatibility. pH. If the pH of an admixture is unsuitable for one of the drug, that drug either degrade or precipitate. Care must be taken especially when a drug with a low pH is combined with a drug having a high pH. An example is the combination of aminophyllin and vitamin B complex with the vitamin C. Aminophyllin has a pH of 8 to 9, whereas the vitamin preparation has an acidic pH. The high pH of the resulting solution destroys vitamin activity. Ticarcillin, clavulonate, dopamine, ondansetron, nitroglycerin, and carmustine are each incompatible with sodium bicarbonate, which has an alkaline pH. Complexation. An example of complexation is the combination of tetracycline with a calcium-containing drug. The chemical complex formed between tetracycline and calcium reduces the antibacterial activity of the tetracycline. Some drugs interact with aluminum, causing a problem in preparation and administration because most needles are made of aluminum. For example, cisplatin should not be used with needles intravenous set or filter containing aluminum. IV solution. Some drugs require specific solution for reconstitution and further dilution. For example, amphotericin must be constituted with sterile water for injection without a bacteriostatic agent and then further diluted only with 5% dextrose injection. Amphotericin B is not compatible with normal saline. Not only is the solution designed to be 5% dextrose injection, but the pH must be above 4.2. Temperatures. Solutions are in most cases more stable at refrigerated temperatures than at room temperature. Cefazolin, once it has been reconstituted in a vial, stable for 24 hours at room temperature, but for 96 hours under refrigeration. Some drugs, however, should not be refrigerated. Metronidazole should not be refrigerated because it causes mannitol in the formulation to precipitate. Some drugs can be frozen after reconstitution and stored for a prolonged period. For example, cefazolin is stable for at least 12 weeks when frozen at -20 degrees centigrade. Ampicillin is an unusual drug with respect to temperature. It is more stable at refrigerated temperature than at room temperature, but less stable at frozen temperature than at refrigerated temperature. It is recommended that many drugs not be frozen, either because freezing has not been investigated or it results in a problem. For example, ganciclovir, trimethoprim, sulfamethoxazole, and imimiram cilastatin should not be frozen. Dilution. The concentration of a drug in solution may be a factor in its compatibility with other drugs. A common problem is the mixing of electrolyte in preparing parenteral nutrition solution. However, the problem can be avoided by assuring that the electrolyte in question are properly diluted before they are combined. Up to 15 milliequivalent of calcium can be added to a liter of solution containing up to 30 milliequivalent of phosphate without precipitation. Higher concentration results in precipitation. Some drugs are backed with a specific diluent for use in reconstitution. For example, the diluent for immunoglobulin is supplied by the manufacturer with specific direction for reconstitution and dilution. Preparation time may be prolonged from 20 minutes with a diluent supplied to 75 and 135 minutes when 3% and 6% immunoglobulin respectively are reconstituted with a 5% dextrose injection. In addition, the diluent and the product should be warmed to room temperature before reconstitution, and shaking should be avoided as it causes foaming. Buffer capacity. In general, IV solutions don't have high buffer capacity. Thus, when a drug with a high buffer capacity is added to a common IV solution such as 5% dextrose injection, the pH of the resulting solution is close to that of the drug added. Important exceptions. are IV solutions that contain lactate and acetate, both of which have a relatively high buffer capacity. Thus, the pH of this solution does not change as easily, making them more prone to compatibility problems. Penicillin G may be added to 5% dextrose injection. Even so, the pH of the dextrose solution may be 4, and penicillin G is not stable at that pH. However, penicillin G contains a citrate buffer that provides a final pH of 6 to 6.5 when added to 5% dextrose injection. The 5% dextrose injection has a very low buffer capacity, that is, it is unable to resist the change in pH when the buffer in penicillin G is added. Order of mixing. In preparation of parenteral nutrition solution, electrolytes such as calcium and magnesium are commonly prescribed with phosphate, creating a compounding problem if not done correctly. By adding the diluted electrolyte last and mixing well after each addition, the electrolytes are well diluted when they come into contact with each other, and the chance of precipitation is minimized. When compounding all-in-one parenteral nutrition solution, the order of mixing is also critical. This complex admixture consists of fat emulsion, dextrose solution, and amino acid solution. Mixing should start with the fat, then the amino acid is added, and finally the dextrose. The important concept is to avoid adding the dextrose directly to the fat because it will break the emulsion, causing it to separate. Plastic. In addition to drug and drug solution incompatibilities, some drugs are incompatible with plastic IV bags and administration set. This is especially true for polyvinyl chloride plastic. The drug may leach plasticizer out of the bag or set, or the drug may adhere to the bag or set, making it unavailable for its intended therapeutic effect. It is recommended that carmustine be used in a glass container only. Cyclosporin and paclitaxel should always be mixed in non-PVC bags and administered in non-PVC tubing. Interferon are not stable in polyethylene syringe designed for use in ambulatory infusion pump. Small amounts of albumin can sometimes be added to the admixture if the drug adheres to the IV bag because it is preferentially adsorbed to the surface of the plastic. However, this is an expensive practice and the advantages of doing so should be carefully considered. Filters. The addition of an inline filter causes an 86 to 94% reduction in the delivered concentration of nitroglycerin. Cisplatin should not be used with filter containing aluminum. On the other hand, it is recommended that some drugs be administered with an inline filter as ganciclovir must be infused using a 5 or 0.22 micron filter. Light, amphotericin B, cisplatin, metronidazole must be protected from light. شكرا.